Dear colleagues, ESCP members, my name is Goran Barisic and I am the ESCP Communication Committee Serbian correspondent. I work as a professor of surgery in the First Surgical Clinic, University of Belgrade, and by this short video I will provide you plain information regarding experience of Serbian surgeons and our healthcare system during COVID-19 pandemic. Serbia population numbers approximately 7 million and its capital Belgrade ranks among the largest and oldest cities in southeastern Europe. The first case of COVID-positive patient in Serbia was registered on March 6th and the second one 3 days after. At that time in Italy, country with most COVID cases in European Union, more than 4,600 patients were registered with almost 200 deaths. On March 15, the President of the Republic of Serbia declared the state of emergency. At that time, 9 days after the initial positive patient, there were 41 confirmed cases and still no deaths from COVID in Serbia. State of emergency implied that all non-essential business, industry and services were shut down together with schools, restaurants, shopping malls, public transportation, etc. Borders were closed and rigorous restrictions of public movement were initiated, especially for older than 65 years old. As the number of positive cases increased, movement restrictions were extended and all public manifestations were suspended, and the policy of distance of at least 2 meters with obligatory face masks and gloves in closed area were introduced. Authorities repeatedly asked and urged for collective support of policy to keep distance and stay at home whenever possible. In schools and high schools, online teaching platforms were created under the auspices of the government. At the same time, healthcare institutions faced dramatic changes. All public hospitals had to comply rapidly with these sudden and not expected circumstances with possibility of admission of affected patients. Green and red zones were created in most hospitals in order to completely separate infected and non-infected patients, while some public hospitals were entirely converted into COVID facilities and were prepared for massive admission of infected patients. Capacity of intensive care units was enlarged whenever possible, and all available equipment and respirators in public hospitals were mobilized and redistributed. A lot of new respirators were purchased, namely for COVID hospitals. At the same time, other non-hospital facilities were also prepared for admission of COVID-positive patients with mild or no symptoms in order to prevent virus transmission and share hospital beds for more severe cases. One of Belgrade fair halls was temporarily converted into a COVID facility, and the same policy was followed in other towns where large objects and sport facilities were used for COVID patients. Private hospitals were not included in treatment of COVID-positive patients, and in fact, most of them were temporarily closed during the pandemic. In the outpatient setting, most of regular visits were rescheduled. At the very beginning of pandemic, like in most countries, we had limited equipment and protective gear in stock, so we had to use it very carefully, but fortunately this improved soon. In order to spare hospital beds and facilities, all elective non-oncological operations were cancelled, as well as most of diagnostics. Only urgent operations were performed, while elective oncological operations were reduced more than 50% due to anesthesiologist shortage, since some of them were relocated to COVID hospitals. At the beginning of pandemic, all patients had epidemiologist survey and body temperature measurement prior to admission to hospital. At that time, we dramatically reduced number of laparoscopic operations in order to diminish virus transmission. Standard protective gear was used in operating theaters because we had no COVID-positive patients requiring operation, at least in my hospital. However, complete protective suits were available in OR in case of COVID-positive patient. At present, every patient must have negative COVID test not older than 3 days prior to admission to hospital. By strict adherence to all procedures, we had every day increase in number of COVID-positive patients, but fortunately this increase was in linear and not in exponential mode. At the end of March, there were almost 800 COVID-positive patients and 13 deaths caused by the virus. Most patients were registered in mid-April with daily increase of up to 450 patients and up to 26 deaths. Maximum number of hospitalized patients was around 3,900, while less than 160 were on respirators at the time, so our healthcare system was able to absorb all patients and was way beyond limits. Since the daily number of positive cases is less than 1% of all tested, we are facing the end of this pandemic in Serbia, and at least we hope that we are. Our community is slowly opening, life is coming back to our towns and streets, and we hope that there will be no second wave of pandemic. But we have to be very careful and meticulously follow daily trends and initiate restrictions again if needed. We still have to keep distance, avoid contacts, and stay responsible in order to stay safe and save our and others' lives. The question now is what next? We have to think now not only about COVID patients, but also about non-COVID, non-urgent and non-oncologic patients who were, I'm afraid, losers in this pandemic because they could not seek and get adequate medical help. The same applies to some oncologic patients who may suffer disease progression due to delays in diagnostic and effective treatment. They are for sure caught the damage of this pandemic. So far they were almost non-visible to medical radar due to COVID noise, but the future will show us how huge this collateral damage was. We should try to give these patients the best possible treatment as soon as possible. In addition, I strongly believe that the most important result of this pandemic should be that in the future we should help each other much more by generously sharing knowledge, experience, human and technical resources, because virus does not respect borders. I believe that no matter how hard, we learned some lessons as a consequence of this pandemic, and I hope that we will, together as a community and as a humankind, come out even stronger and more dedicated as many times before. Keep distance, be responsible and stay safe. Best regards from Serbia.